Hi everyone, thank you so much for joining today. My name is Frances Corcorran. I am a registered nurse and case manager working in maternal child health. And I'll be doing a presentation today on how to best maintain connection with our families right now that we work with during COVID-19. So I'm just going to share my slides here real quick. Okay, so hopefully you can see these slides. As I mentioned, we're going to talk about maintaining a connection with families during COVID-19. So I know things are really challenging right now and it's easy to kind of focus on the negative. So I just want to bring in the positive that we have of doing things virtually right now and doing virtual visits with our families. So some of the good things for me that I found of doing virtual visits is the flexibility, the comfort, getting to work from home, not commute, the safety, staying safe from COVID, being able to work from home and not be at risk, putting our clients at risk, or ourselves at risk from meeting each other. And then the speed too. We gain a lot of time back by not needing to, as I mentioned, commute or drive around different places. So we can gain back some of that time during the day. So I feel that there are a lot of good things about doing virtual visits. It's easy, as I mentioned, to focus on the negative. So trying to focus on the positive of the virtual visits, I think, can also highlight for us, what we like about doing this work and help us to be more engaged with our families. That said, as I mentioned, there are so many challenges of doing this work. There's challenges with connecting with families during this time virtually. So I just encourage you to think of maybe what are some of the challenges that you have faced in connecting with families, and use that as a point to think about in what ways can we improve. In what ways can we kind of change things in order to connect better with our families. So I know some of the challenges can be, people might not participate. They might not like to do virtual visits or talk on the phone. There's also a lot of difficulties with connection sometimes, or Wi-Fi, having access to Wi-Fi or data for families. And then of course also just not being able to be there in person, not being able to get as much objective data during our visits when we're on the phone or on video. It's harder to get as much information and do as good of assessments. So that's some of the challenges I've faced. Hopefully we'll talk about some of the challenges today that you faced, or kind of how to resolve those things to think about. But I encourage you to think about the challenges and think of how could we resolve this so that our families can continue to participate. So starting now into thinking about how can we connect virtually, what are the things that we can do to best maintain that connection with our families. So one of the things that I found really helpful is using video. So rather than trying to maintain the connection solely on the phone or via text or message, trying to use video whenever possible to connect with the families. So in my experience, using videos with the people that I work with seems to really increase participation. Moms that I work with seem to be more engaged in the visits. They seem to like the video, and the visits tend to be longer in a good way. We're talking more, doing better assessments, getting more data and information. It's easier, of course, to see the mom or the family in the video and kind of get a better sense of maybe what unique experiences they're having right now or things that are happening for them, better than when you're just on the phone. And then also just seeing each other on video can help increase your bond between you and the family that you're working with, which can really help them continue in the program and increase their participation and commitment to the program. So there's lots of different ways that you can use videos with clients. There's so many different apps out there. So there's things like WhatsApp, Zoom, Google Meet, even Facebook Messenger. So depending on what is allowed in your area or by the organization, you can use a lot of different things to connect with families. Another thing that I've learned over the years, and which we talked about a lot when I was volunteering with CMMB in Peru, is that it's important to focus first on the mom and the family. So sometimes we go into visits with a whole agenda of what we need to get done or what we want to talk about with them. But it's important to first kind of sit back and let the mom or the family tell you about what's going on with them. I learned that when we focus first on what we want to get done, oftentimes the family maybe won't be able to actually focus on that or put that into practice because they have other needs that maybe need to get met first. So focusing on the family or the mom first can help free up some space for them to then focus on what you have to say and the information that you're trying to share with them. So we know that moms and families are so busy right now, right? They're moms, they're parents, they're teachers, teaching their kids at home, they're nurses, there's so many more things. So they're holding a lot of hats right now, and giving them a little bit of space to speak about whatever's on their mind first can help free them up to listen in about maybe whatever information or education you're wanting to bring them. So technology can be such a blessing and such a challenge right now. But if we are going to be connecting with our families during this time, it's so important that we utilize technology to the best of our ability. So it's important to just get to know the technology that you're using, whatever it is that you're going to be utilizing to call or do video visits with the families, whatever you're utilizing in your day-to-day, important to get used to that. So take a little bit of time to get to know it, get to know the apps, the technology that you're using, and if health promoters are expected to be using it, also taking time with them to educate them if they're not already aware of kind of the different apps or different things that they're expected to be using or that they could utilize in order to connect with families. So allowing for space for that will help everybody be able to be more effective. Also with technology, as we know, there's so many problems that can come up and disruptions that can come up. So it's important to think ahead about what are the disruptions that could happen, say while you're on a call with the family. What are the things that could happen that could kind of go wrong, and maybe have a plan for how to resolve those ahead of time. So maybe you're on a call with a mom or on a video visit, and the signal goes out and it cuts out. So kind of having a plan maybe with the mom ahead of time of, are you going to call her back, or is she going to call you back, or will you try another day? So kind of having those plans set out ahead of time can just make things less confusing and easier for everybody. Also can help maybe the mom stay engaged if she feels like she knows what to expect. There's not necessarily any one right way to do anything, but just for yourself, having a plan of how to do it can keep things running more smoothly. So privacy is another really important topic. Now that we're all working from home, or maybe not going into the office as much, or being out in the field as much, it's harder to ensure privacy when we're talking with moms and families when we're at home or maybe around other people. So it's important to find a private space, as private as you can, where you're working from, to be able to talk with the families so that it feels for them like it's private and they don't feel like your whole family or everybody else in the house is listening in on the conversation. It really is important to respect their privacy during this time. So what I like to do is I use headphones so that when I'm talking with moms, they can see that I'm the only one who can hear what they're saying. I also go into a separate space and reduce distractions so that I'm fully present with them and they know that I'm listening to them and that there's not anybody else that's listening into the conversation. The other thing to keep in mind is that if you do maybe have to ask some sensitive questions or get some sensitive type of data, or that type of topic comes up, that it's important to ask permission of the mom or family first before going into that, so that they have a chance to say no, that they don't feel comfortable speaking about that right now if there's other people present, that they don't want to hear that conversation. You can also ask if there's other people around, you know, to see who's there and to make sure it's a private space for them as well. So the other important thing to think about right now is flexibility. Flexibility is everything, as I have said here. So these are really hard times. We are all going through a lot, and it's really important to be flexible with our families and with ourselves about how things get done right now. So in order to keep ensuring that families want to come back and participate with us and want to stay engaged, it's important to offer them flexibility so that they feel that they have some agency in how the program is working for them. So maybe there's you know, a specific time of day they want you to call. Maybe there's a specific way they like to do the visit. Maybe they prefer video over phone or phone over video. So whatever it is, ensuring that they have a lot of flexibility, a lot of choice in the program. And then, as I mentioned, for yourself as well, it's important to give yourself flexibility because it's hard right now to be doing virtual work and doing this work, not being able to be with our families. So making sure that you're flexible with yourself and are realistic with yourself about how much can be done right now and how much can get done. So having a little bit of flexibility around that. The other thing to keep in mind is we want to really listen a lot when we're doing virtual visits with our families. We want to listen more, talk less. Right now that we're not in person, it's really hard to have those body cues, you know, those signals about when somebody's stopping talking or if there's more to be said. So it's important to really listen a lot, allow space for the mom or the family to talk. And then when you're sure that, you know, they're finished sharing, to speak then. So I encourage people to just listen more, talk less, to give lots of space to the families. Another thing that I find really useful is sending information before or after visits. So now that we're not in person, we can't have those visual aids with us always, or we can't hand off an informational sheet to the family in person. So it's still important for them to get those type of resources and that information so that it can help them understand the information that we're talking about or help them remember it better. So those things are still really important. So I encourage people to send that information rather than maybe something that you'd give them in person. Just go ahead and send it over message or email, or maybe sending a visual aid so that it's something that can stay in their mind so that they remember the information that was given. It's also something that they can then go back to in the future if they forget or they want a refresh of the information that was discussed. Another important thing to keep in mind is organization. So definitely encourage people to get organized first before engaging in virtual visits. Right now, working from home can be very chaotic. We have everything in the same place, the personal stuff, the work stuff, everybody's home. So it can be really hard to stay organized. So when you're gonna make a call to a family or a mom, encourage you to just get organized first. Take a little bit of time to maybe write up your own agenda, knowing that the mom might take it in a different direction. But having a little bit of an agenda, knowing the information that you want to share with the mom, having some resources handy if she has any questions, and then kind of just knowing your schedule for the day will help things run really smoothly and help things feel a little bit less chaotic for you and for the mom or the family. Another thing important to keep in mind is that we need to ensure that everybody has access to the technology or the things needed to do their job right now. So right now, while we're doing things virtually, it's so important for people to have access to technology. If they don't have access to a working phone or a working computer, Wi-Fi, data, things like that, then they're not going to be able to do their job as effectively or even at all. So it's really important to ensure that all members of the team and the health promoters do have access to the technology that they need to really do their job. And again, this might involve doing some teaching, doing some educating people on the different ways that they can utilize the technology, or what's expected. But it's important to ensure that everybody has access to that so that they can do their jobs effectively right now, and so that we can continue to support the families that we support that can benefit from this program so much. And then lastly, and I think the most important thing of all, is self-care. So it's so important to engage in self-care. If we're not able to take care of ourselves as healthcare providers, then we are not able to as effectively take care of our families. So really, really important to engage in that self-care and that connection with your inner self. So I encourage everybody to have self-care practices that they can do on a regular basis. Could be something like talking to friends, of course exercising, meditation, yoga, doing artwork maybe, or gardening. So whatever it is that helps you to feel calm and reduce your stress and for you to feel taken care of. So important to have those practices in order to continue doing this work and taking care of other people. We first have to fill our own cup before we can help others fill theirs. So I encourage you all to find some self-care practices that feel really nourishing for yourself. So that is my presentation. I'm going to stop my screen share right now. And thank you so much for being here. If you have any questions, please feel free to email me. My email is just my name with a dot in between @gmail.com. So you can email me any questions that you have or any other any comments that you have on this presentation. Thank you so much for being here. Take care and happy holidays.